Lieutenant General Ritterman, thank you very much for being on the programme today. You're leading the NATO effort to try and get key supplies to member states around the world. What is it you're doing?
What we are doing in Allied Command Operation, and singularly here in Supreme Headquarters Allied Powers Europe in Mons, Belgium, is strategic coordination. So we do this for a living, and we do this in order to accomplish our normal main mission, the principal responsibility we ask for the Alliance, which is preserving peace in the area, for that to be able to deter and defend against any aggression. In the framework of that mission, we have dedicated teams whose daily job it is to plan and move supplies, troops, and equipment across the area of responsibility. So we can, with this mechanism, match actually the requests from the nations given to the clearinghouse in Brussels with the available strategic airlift that the nations will provide. And this is then the rapid air mobility mechanism. And this was actually used, as I'm talking to a British show, by Turkish airplanes over the Easter weekend to ship medical supplies and personal protective equipment to London over the Easter weekend.
That personal protective equipment is something that's causing a lot of worry here in the UK. Reports that there's a global shortage and that now the advice has changed so that doctors and nurses in the UK can reuse some of the gowns. Is there enough protective equipment to go round?
Well, I mean, it's not for NATO to answer that question. The problem of the stocks, I think everybody was taken a little bit off guard by this crisis. No one was really completely understanding the full expense of the health crisis we are facing. The shortage is global. What we can bring to support the teams that are dealing with that is managing the coordination of the strategic airlift, which can pick up the personal protective equipment where they are. After that, what the nations decide to do with the personal protective equipment and the reuse of them is really a national decision.
And how do you work out what numbers of protective equipment and medical supplies goes to each different country?
Well, we process the requests that are posted by the nations to the coordination center, the clearinghouse in Brussels, and we simply answer to a request to the nations. But what we don't do, we do not interfere with what the nations do on a national basis. And I mean, all the nations have taken all appropriate measures to deal with the crisis in their own boundaries and to protect and save their own people in an emergency, and that is all right. So we are not interfering in that. We are just giving some coordination measures to enable the process to go faster.
Now, there's reports that some equipment from China intended to go to France was intercepted and ended up going to the United States. Are you seeing countries looking out for themselves in this crisis?
No, that's not what I'm saying. What I'm saying is that in the initial phase of the crisis, the nations had to react very quickly in face of a crisis that was completely unheard of before. So they took all appropriate measures to make the best choices. But of course, when you make a choice, you're always being able to be criticized afterwards. So I'm not referring specifically to any country or any decision that was made. We are in the context of a world crisis with a shortfall of equipment that was not considered as strategic before this crisis burst out, and so we have to cope with it.
OK, now Tobias Arwood, the former Defence Minister here in the UK, has criticised the NATO response, saying NATO needs to wake up and do more. China and Russia we've seen being very quick and getting medical supplies to some European countries. Has NATO been too slow?
First of all, let me get back to what NATO's core mission is and the principal responsibility towards the citizens of this alliance. We are here we have been created fundamentally to preserve peace in the Euro-Atlantic area. To do that, we need to be able to deter and defend. And this mission is continuing. So we have no impact from the COVID on the accomplishment of our mission, on our posture of deterrence. Now, NATO is not the first responder for this crisis, and that is pretty obvious because it's interagency, intergovernmental, and it's much wider than the simple military response. We can provide, and we do provide support to other agencies. I mean, all the NATO allies, the militaries of the NATO allies, have been providing this kind of support in their own countries. So far, we have deployed 4,000 medics, doctors, nurses across the different nations. We have deployed a 250 field hospital, which amounts to something like 25,000 beds. We are providing this coordination mechanism with the rapid air mobility. Over 100 flights have been conducted to ship the equipment. So saying that NATO is slow to wake up or is not doing anything is not fair, because we are doing quite a lot.
You're very robust there, defending NATO, saying that it's unfair to describe the response as too slow. There's also been some criticism of the EU. They've apologised to Italy for not acting so quickly. Do you think at these times of crisis, people turn to these big multilateral organisations like the European Union, like NATO? Have they been found wanting?
Well, I think the big organizations are something that is very reassuring, but you need to understand what the purpose of the organization is. An organization like NATO is not a disaster relief organization. It's not been created to do that. It's been created to defend Europe against the Soviet Union in the 50s. So we have now changed the mission. The mission is still defending and deterring. This is the core mission, and this is not going to change. What we can bring to bear upon is the skills we have, are the structures we're operating, and the professionalism of our teams. We have teams whose job it is to do crisis management. Of course, it's more in a military sense of it, but actually a crisis is a crisis. So if we have the resources and the directives and the guidance to conduct a crisis planning, we have all the professionals to do so.